Hello, everyone. Thank you very much for joining us today for this peer-to-peer session. Interns at WHO headquarters, who they are, what they do, and how to become one. I hope everyone can hear me properly. In case you have any problems with the platform, please write it down on the chat, and we will try to assist you as soon as possible. I would like to start by introducing myself. My name is Viveka Guzman. I'm a project and partnership supervisor at Global Health Next Generation Network, and I'm also responsible for this peer-to-peer session, so I'm very happy to be here facilitating this session today. Before we get started, I would like to state some basic guidelines for online meetings. So please remain muted whenever you're not speaking, so we can avoid as many additional background noises as possible. And if you have any questions during the rounds or the presentations, please use the Pigeonhole link that we sent in the reminders to add any questions and vote for others. And this way I can easily identify what questions you find more interesting and give them priority. I would like to remind you also that this session is being recorded and we will share it with you afterwards. So you can go back and listen to it again in case you missed any important information. Today's session is expected to last about an hour and a half, and this is the agenda for today. So I will make a short introduction to the network and what we're doing, and this will be followed by the question rounds where the speakers will share some practical information and talk about their own experiences as WHO interns. And after that, we have some time left. I will open the floor for any additional questions you may have. And finally, we'll have a few closing remarks. So the Global Health Next Generation Network has the aim to be a platform for the exchange of expertise, knowledge, and opportunities between global health students and young professionals from different cultural backgrounds and also professional backgrounds. So I would like to invite you to browse through our website, and we have a new section that is publishing at least an article per week, and also different projects are happening. So hopefully you will have motivation to get more involved with us, and we're always looking for new projects, different ideas, and new partnerships. So please get in contact with us and follow us through social media and help us share information. And so without further delay, I would like to introduce you to our speakers today. So the three ladies right there, Alexandra, Dina, and Ranya, and they're currently doing their internships at WHO headquarters in Geneva. And well, they will tell us a little bit more about themselves and their experiences in just a moment. I will just like to tell you that for the question rounds, each one of the speakers will have the opportunity to answer the same question from their own perspective and add some additional information. And the order to answering the questions will be on alphabetical order. So Alexandra, Dina, and Ranya, and then we will start over. And please keep an eye on Pigeonhole to add any more questions. So let's start with the first question. So Alexandra, can you tell us a little bit more about yourself, your professional background, how do you get involved with public global health, and what are your areas of interest in the field?
Can you hear us?
Can you hear us?
Yes, we can hear you.
Okay. Hi. I'm Alexandra. I'm
Dina. Ranya.
Hi. Okay. So my background was, so I studied a medical degree, and I've just graduated in July of this year. And I'm from the UK. And so normally in the UK, you graduate medical school and then go straight into professional training. But I wanted to get a bit more experience in global health, public health. So that's why I decided to do this internship. And then I suppose my long-term career options are to go back to working as a doctor in the NHS, but ultimately to try and incorporate working in public health alongside that, or maybe in UK government, or maybe do more global health. But this was more to get a broader idea of what working at an organisation like WHO involved. And so I suppose I got involved with, I got interested in global health. I mean, it's something I found interesting from, learning about politics, learning about medicine in different contexts across the world. and I've always thought it'd be something I'd be interested in. And then I did a research project as part of my degree looking at cancer registries in Latin America, which really, I suppose, got me quite interested in the field. But I thought that coming to somewhere like the WHO would give me a different side. So I'd only previously done the research side of global health, and I thought that this would give me a good insight into, you know, the day-to-day workings of an organization like that. And I suppose my areas of interest, I'm quite interested in like child and adolescent mental health, and I'm also interested in geriatrics and aging, which is, you know, something that's becoming much more, you know, of a pressing issue worldwide as, you know, people live longer and people start to die from things like non-communicable diseases, which is the field that Dina and I are working in here at the WHO. So yeah, that's a bit about me, and I'll let the other two speak now.
So you like the young and the old.
Yeah, pretty much, yeah.
Hi everyone, this is Dina. Can I just right up front ask how many people are following this right now and how many people are online?
Yeah, we have 26 participants.
Okay, great. Hi everyone. My name is Dina. I have a similar background to Ali. Obviously, I'm also a medical doctor that's recently graduated, but from Germany. So for us, it's pretty much the same. We have our 6 years, and then we're supposed to go into our residency or like specialization. I've been involved with public health or global health quite early in my medical studies, due to being part of a member of the IFMSA, the International Federation of Medical Students Association. And because of that, shout out to all the IFMSA members out there, if there's anyone following. Hi.
We can only see 3 people,
Yeah.
so you're the 3 people who just, I don't know if you know who you are, but yeah.
But yeah, so apparently you know from IFMSA that you get involved with public health and global health pretty early. And this just sparked my interest, and also with doing field work at home with working with refugees and migrant health and so on. And then of course there was this option of having, you know, taking into consideration what the top organization that basically governs the whole global health aspect over the world acts, and how it actually on a daily basis, how their work looks like. So of course you always would get in touch with WHO throughout your studies when it comes to recommendations and definitions of diseases and all these kinds of measurements that WHO would pass. But then also you would want to get in-depth, you know, aspect of their daily work and what happens to the recommendations that they pass and how they are created. So that's how I wanted to this sparked my interest for interning with the WHO. So my basic areas of interest in the field of WHO are more medically orientated, because as Ali, I also did my research on oncology and radio-oncology. So I had the expertise from here, so applying for the GCM, for the Global Coordination Mechanism on NCDs, was actually a good fit for me, with getting to know the global aspect on how NCDs are governed worldwide. So that's why I applied for that specific department.
Do you want to go? Hi, I'm Ranya. I have quite a different background to these both. My background, I did a master's in control of infectious diseases. My first degree was in biochemistry, and then I decided that it wasn't quite for me, and then worked in an NGO in the UK, and then also volunteered with some other global health organisations in the UK. And then I did my master's at the London School of Hygiene and Tropical Medicine, and I've just graduated from my master's. And I got involved in global public health after my undergrad. Actually, I didn't really know the area of global health really existed, but I knew biochemistry wasn't for me. I wanted something that was a bit more on a larger scale, on the community level, the global level. So I kind of looked around, and the medical association, but the UK-based one called Medicine, they have lots and lots of events and things going on in London, so I kind of got involved with them. And I was thinking at that time that I was thinking about maybe applying for medical school, so I got involved in medicine, and then realised actually I really, really enjoyed the global health side much more than the direct patient side. So then I did my master's and absolutely loved it, and had a focus in epidemiology, infectious disease epidemiology. And now at WHO, I'm interning in the health emergencies program here, which is working on outbreaks and epidemic diseases. And specifically, I'm in the yellow fever team. Yeah, so my main areas of interest are kind of infectious diseases and emerging infectious diseases, particularly those of epidemic and pandemic potential.
All right, thank you. Thank you so much.
You already answered the question too, by the way.
Yes. So I think we can skip this one because it's why do you decide to apply? Where are you doing your internship? So we can go to next one.
The way both do, yeah. I said it already.
So this one is about the application. So can you tell us what were your considerations before going to the WHO headquarters, and how do you apply yourselves? Do you have any recommendations on how to make an outstanding application?
Okay. So one of us start first. Do you want to go? Or?
Yeah, I can go. So for me, it was, unlike many other people, it was actually an open call that I've been following. So there's this department and they just had this open call for interns. And hi, we
can't see the screen. We can't see the screen anymore. We can just see Viveka just really big. So I don't know if that was on purpose or not. Yeah.
But okay, I think I'll just go on.
What's an open call? Sorry. So how did they put it out?
So the open call was actually through the IFMSA streams, because we have a memorandum of understanding with the WHO. So they will primarily, depending on their needs, they will primarily, of course, work with youth-led organizations that work on health and have background knowledge on this.
Right.
And so there was this open call, and I applied for it, and apparently it was open to many people, all the members of IFMSA worldwide, which is more than 159 members. Correct me if I'm wrong, NMOs. So yeah, and then I applied to it, and then I had this interview process, and then apparently there were many people selected for the interview process, and out of the interview process I got selected for that. So I think what recommendations that I have to make an outstanding applications, I think you and yourself and your achievements and your CV are outstanding in their own way, and you should not be because you don't have any fieldwork experience or any awards or scholarships you won, or you don't think, that should not prevent you from applying for any internship. I mean, no one is really right? No one is really the genius in here, or all the interns have different kinds of backgrounds and different achievements in their lives. But also, if you think of yourself of having just some mediocre achievements in your life, I think that should not prevent you from applying, because you never know and to what extent you and your skills match to the needs of the department. And I think this is precisely what will make your application outstanding, is in working out how your skills and what your talents are and how they would suit and how they match with the needs of the internship. So apparently if you have an official call, there will always be, this is what we need from people, and this is what we ask for, and this is what you're going to do. So if you think you can match your skills to it, and it will be easier for the department to determine to what extent you are suitable for this position. So if you can work this out and make this shine in your motivation letter, I think this is a good way to make your application stand out.
Shall I speak?
Yeah,
So I applied for my internship via the WHO website, which is apparently, like, according to the WHO, that's like the only official way you can get to do an internship. And although quite a good proportion of people I've spoken to have either got their internship through an organization such as your medical student organization, through their university, or just emailing people directly, which I didn't realize at the time was something you could do. So I just applied via the website. I've printed out my application here so I could have a look through it. So I mean, to be honest, I'm not in the HR department, so I don't know what they were looking for in particular, but I'd say, again, don't be put off. Like, I was a bit uncertain whether I should apply because I don't have a background in I've never really done much public health before. So I was worried I wouldn't have anything really to talk about on my application, but I think they quite encourage you just to, you know, use whatever experience you might have and draw skills out from that, because there's a lot of your day-to-day work at WHO doesn't require, you know, you're not going in there to be, you know, the head of a department or something. You don't need great in-depth knowledge into something. A lot of the things I think they'd be looking for is just general. So I think I wrote about like just general skills I feel that I'd gained through doing things like I did a lot of debating society at university, so I talked about things like work, you know, teamwork through being on the committee there, organizational skills I developed, and you know, and I just tried to think of skills that might be relevant for the work of the department. So yeah, so teamwork, things like I think knowing how to multitask is quite important and prioritize, because I thought as an intern you might get given lots of different jobs from different people, and it's up to you to, you know, organize your own time, meet all the deadlines. So I think a good work ethic, I suppose, and just being able to work independently and take the initiative. Just, you know, all these quite generic skills, but just showing how you you can demonstrate things like that. And also I think it's important in your application as well to just show that you really do have a passion for global health or public health, and you know, and I think that's why they'll take you on, because they want to, you know, give people experience who are then going to go on and work in this in a future career. They don't want people who just want, you know, the words WHO on their CV. So I think just really trying to show you're passionate about it and try and let that shine through, rather than worrying about you might not have this qualification or that or whatever. Yeah, so that's what. Yeah, and sorry, with my application process. So I submitted this back in, I think it was end of September. Then I got an email from the assistant in our department asking for a telephone call, probably like a month later. So had the call with her, and then they said pretty much, you know, I mean, on the phone while we were having the interview, it was more of a casual chat rather than the interview. She was like, "Hey, you can start," and then I started about a month later. I just had to submit some paperwork, so it was actually quite straightforward. Yeah, so excited.
So I was one of those people who got around the system, and I emailed directly my supervisor. So what happened was I had done a research project on yellow fever as part of my master's. My 3-month dissertation project was focused on yellow fever in a very specific area of Ethiopia, and I thought, oh, it'd be really interesting. And it was very based on the vector side, and I thought that it would be really interesting to see the global level a much more of a larger strategy. They just launched a new strategy. All the yellow fever endemic countries, yada yada yada, and so I thought it would be really interesting to focus my efforts and build up my knowledge of yellow fever, but from the vaccine side. So I found the focal point of yellow fever and emailed her directly, and I also emailed the director of the whole department, who then so then I ended up speaking directly to the person that I wanted to intern for, and the same she replied to me, and we had a telephone call, and yeah, it was a lot more of a casual conversation than an interview, but there was still the classic questions of an interview, but it was kind of just to get to know you. And I would say that the main things to think about when you're applying is or to make an outstanding application, I guess, is to think about what your skills are that they really benefit for. So specifically in most of my experience is here in health emergencies, and most teams are understaffed at the moment. They're struggling with smaller teams than they're normally used to. So having an intern absorbs quite a lot of the excess work that's really good, because you get lots of responsibility and exposure, but it means your skills that you have are really used. So for example, I did a spatial epidemiology course, part of my master's, so basically making maps and analysing spatially. And so here I'm making a lot of maps for my supervisor. She knows I have that skill and I get to use it a lot. And that was something that she highlighted when she gave me the internship. She said, "Oh, I saw that you know how to use the mapping software, and that's something that we really need, that we're missing." So that was something that she told me was really of added value. And also my experience working on yellow fever in a country level, which is quite unique, I guess. It's quite random, I guess, to have that experience. And so both of those things added to my application, and she told me that those are the two things that stood out for her. In terms of the thing that should be considered before you apply, I think we're going to come on to it later. The main thing that I was apprehensive about is coming to Geneva as an unpaid intern. I think we're going to talk about it much more, but that was my main consideration, actually, one of them. There's so much you learn here at WHO. The unpaid intern, but also for me, I'm interested in epidemiology and outbreaks and emerging diseases. And it's difficult to do it at the global level. It's difficult to do it here in Geneva when you're working on things that are happening so far away. So another thing is the fact that you're working so far away, you're not really getting close to what you're trying to study. But at the same time, it's really, really a value to come here and see how it works here and how they watch outbreaks happen from so far away. And for me, WHO is somewhere that I'm not going to come as mid-career. I'm either going to come as an intern or low level, or I'm going to come hopefully at some point in the future as a senior person. And again, we'll probably come on to this later, WHO is not the kind of place to be when you're starting off your career or mid-entry, in my opinion. So for me, doing the internship was my way of getting that experience now rather than later, basically. Yeah, I think that's enough for me for now.
Okay. I have here some questions from the Pigeonhole that are related to the application. So when will you say is the best timing to search and apply, for example?
So for me, I on the official website, it says there's 2 rounds of applications, but actually there's not. I don't know who's going to be listening to this and they're going to get angry about me, but I'm going to be completely honest with what I'm saying because it's true. For me, I contacted my supervisor directly, and it's not that she had an open position. It's not that she only wanted someone in the winter or someone in the summer, which is what it says on the website. I wanted to carry on my working in global health after I graduated, so I was looking to start sometime in October, and that suited her as well. That's not always the best for everyone. Maybe they don't have a position, but at the time she thought that I would fit into that team. But I wouldn't say, okay, hold off and wait till winter. Just email when you want to inquire and see when it works well for the team. And maybe they don't have time or space for an intern right now, but maybe they can forward on your CV to someone else who then has an opportunity for you. So I'd say, yeah, that's in my opinion, there's not a best time. There's going to be people who need people now. There's going to be people who need people in 6 months' time. I say put your application in, put your CV in, and then see what happens. And then, yeah.
Yeah, but if you are applying, if you don't have someone to contact directly and you are just applying through the general pool, then yeah, there are two cycles and you have to apply by a specific deadline. I think there's the applications are open for a month. A period of a month. So I can't remember which month it is in the spring, maybe April or something, and then I think it's open for the whole of September for the winter cycle.
Mm-hmm.
You just apply them and put your dates in. I would say actually, while I remember something to do with dates, so I'm doing a 3-month internship and I started like 2 weeks before Christmas, and I would just say that this is not a good time to start because basically the whole WHO kind of shuts down a bit over the Christmas period, which, I mean, like, if you're here for a longer period, if you've been here since like October, that's, it's fine, like you can go home for a week or 2 to see your family. But for me, because I wasn't there very long, I think my first month here was turned up for 2 weeks, there wasn't really much happening, and then everyone went home, so I was like, well, I'll go home for a week as well. So, I was paying all this money for renting a flat in Geneva, and I wasn't, really using it, or if I was at the WHO, there wasn't really much happening that I could gain from. So it wasn't until January that I actually really started to get into my internship and felt I was gaining something out of it. So I'd say, yeah, don't start just before Christmas.
And in terms of your start date as well, something to consider. So I had a start date that we set. Then I got here and found out my supervisor was away on mission for a week and a half. And so I was pretty much sitting waiting for her to come back, because she was the one who was going to introduce me to the teams, the one who was going to introduce me to my project. So yeah, make sure that your supervisor's here when you start, so that you're not just kind of sitting around and waiting to get started. Push back that date for another week and come then, because it really does make a difference.
Yeah,
they are
to make
flexible anyways.
true.
It's not that you have to start. But I think another aspect to also consider is when you want to do it career-wise, at which stage of your career. I mean, for me, it was important to be able to, to finish my studies completely and not have anything that still is waiting for me when I come back after I finish my internship. So I already had the acceptance from my internship like 2 years ago or something, but I deferred it until I graduated, which was completely fine. But it also depends on the needs of the department. But I think for you should consider this is a 3-month full-time internship you're doing. So if you're able to do that in the midst of your studies, whilst you might be able to have funding whilst you still have your student status, I think that's a good thing. But then also, if you can't take a break from your studies, I think you should make sure that you at least finish some, important project that you need to finish, some important exams before you take up that commitment, because it really is a full-time studies. And, trying to work next. I think there's a question coming up on working on your thesis next to your full-time internship. I'm currently doing this, but it is difficult. Yeah. Oh, yeah. Okay. So I think,
Right.
What does that mean? It says there's 9 minutes remaining of our meeting time.
And the other question that's kind of related is, how long is the usual internship? Like most of the interns, how long do they stay in their position?
There's no usual time. It's anywhere between 6 weeks and 6 months, and I've met people who are doing anywhere between that. Some people are 6 weeks, some people 6 months. It really depends on the project. Depends on your supervisor, depends on time of year, depends on so many things.
It depends on if you're sent by your university, if this is a task that you have to do, if there's coursework on it, or if you're doing this for your own.
Yeah.
Because I thought, you can do a minimum of 6 weeks. So I kind of, in my head, was thinking, okay, I'll do a 6-week internship. That should be enough to get, a good something out of it. And when I had my interview, the person interviewing me said that our department only takes people for a minimum of 3 months. So I think maybe that's something else to consider, or something to kind of include within your application, because if maybe you don't think you could afford to stay in Geneva for very long, and you could only afford to do a 6-week internship, I think it's important to say that early on, so that they know before they interview you, if they're able to take you on or not. Which I think, and then they, which they should be fine. Like, they should be able to find someone who's able to take someone for 6 weeks. They understand that that's not always possible for people to do longer, but it's something to say.
I think in my opinion, is 6 weeks isn't long enough. It's not ideal, and of course people have to do it if they there's different reasons why you can't do longer, and that's completely understandable. But if you can do it longer, it's better. And if you can maybe negotiate, I got advice from a friend who had done an internship before, and his advice to me was, if you can't do it for as long, maybe you can speak to your supervisor and say, can I do 50% in Geneva and 50% away, or something like that, where you can negotiate that you're still doing it longer. Because really, firstly, you have to be in Geneva to get the full experience, but at the same time, it's better to do it for longer if you can. You really don't get stuck into your own project until 6 weeks, until 2 months in, to really get to know people, to get to know your project, and actually get something feasible out of your time here. 6 weeks is a short time that you're pretty much going to be shadowing people and doing some emails, but longer than that, I think you can really get stuck into your own project and really have something feasible that you can say you've done during your time here.
But if you can only manage 6 weeks, I still think it's a good thing to do, because it does, people will want to get different things out of an internship, and Should we move on? Sorry, there's a little thing at the top of that screen saying...
I just saw it. I'm trying to fix it, but it's probably going to kick us out. So I will send you a second link to your email. Okay, I'm so sorry this happened. But we can start with next question, but we probably won't be able to finish. So just take a look to your emails. I will send the second link. Okay. Sorry. Okay, so the next question is about finance. Can you tell us about how you're funding your internship? Is there any possibility to get financial aid? And do you have any tips regarding expenses, housing, and insurance?
I can go first, yeah, sure. I'm self-funding. Are we still online? Yeah. I have the support of some savings and my parents who are helping support me. I just finished my master's, and I had pretty little money left after that. Doing a master in the UK is not cheap either. In terms of the possibility of financial aid, I think really depends on where you're from, the country you're from. Most of the people I know who are funded to be here are either through their university or through their own government. From WHO side, absolutely no chance of getting any support from WHO. But there's quite a lot of opportunities if you look around to get supported by your government or through other programs. I know Germany have a good program.
Oh, yeah, they do. But that's
yeah, exactly. The programs we know of are all very competitive, but there are some out there. But I'm not the best person to know about that. In terms of tips regarding expensive housing and insurance, expenses is high in Geneva. My rent itself is 700 francs a month, and I'm sharing with quite a lot of people in a small space. It's not cheap.
So 700 francs will be about, what's that, like £500?
Yeah, £600. I don't know where our viewers are coming in from.
I don't know how many Americans,
but you can,
probably about like 550, 600 euros, I think.
And in terms of tips on housing, I don't know if that means like where to find housing, but there's some good links on Facebook. There's some really good links that there's actually a WHO unofficial interns page where there's quite a lot of links on there. I don't know if we can share some links after this. Maybe, for example, the FAQs on the WHO intern page could be really useful, and also this unofficial website. And they have some really good housing. It's really easy to find housing actually in Geneva. I don't know how you found it, but I found it quite easy in terms of there's always a really fast turnaround of rooms. A lot of people come here for a short amount of time, so there's always rooms going. I mean, some of them are far away, some of them are expensive, but there are rooms available, unlike other places in Switzerland. So that's good. And in terms of expenses, again, you can do it quite cheaply. I mean, you can get a bike, especially in summer. I've got a bike, and it means I don't have to pay for the bus pass. But also, for example, the bus pass is cheaper if you're under 25, I think.
Yeah,
like and things like that. So there are ways to go
for all of
it.
Geneva.
Yeah. For me, so so I'm again like self-funding my internship. My parents are not going to give me any money, so because I graduated in July. I graduated in July. I didn't start my internship until the beginning of December, so I just worked waitressing for about 4 months. Which I think it was a good way almost for me of like, proving I was committed to doing this internship, because I was working like 6 days a week, waitressing, saving up money, and that's how I funded it. Oh, I also got like a very small grant of like £200 from some like local organisation fund thing in the little islands I live on. But just from that, I'd say like literally look for any source of funding. There might be just, if there's any kind of charitable funds or anything in your area, whatever, just kind of email around, send out lots of emails. You never know, because these people were like, yeah, sure, we can give you £200, and it all adds up. So just send out lots of emails, just try. So that's how I funded it. And again, like, because I'm from the UK just doesn't do anything. They don't give you any kind of funding at all. So any tips regarding expenses? Like I said, it can vary. If you want to do it on a budget, I think it is, it's doable. There are ways to save money. You can, like if you go across to France, it's a lot cheaper to buy groceries. Also, housing in France can be cheaper. So I think just expand your horizons. You know what I mean? Exactly, because Geneva's so small. So actually, just living across the border in France, in Fenny-Voltaire, is actually very close to getting to Geneva and might save you money. So drinks are expensive in Geneva. Eating out is very expensive, but I think if you're just sensible with money, I think it's doable.
Mm-hmm.
Yeah.
Okay, I will send you the link in just a minute and see you all back.
Okay. Great. Okay. Bye.
And I'm actually coming to the end of my internship. This is my second to last week. We'll be here 4 months in total. My working life. I came to work on a specific project as part of this, yellow fever strategy. But when I came here, it was the start of a yellow fever outbreak in Nigeria, and then at the end of the year, beginning early this year, there is ongoing an outbreak in Brazil as well. So actually turned into doing a lot more working on those outbreaks, which has been super cool because that's the kind of stuff I'm interested in. So they call it like epidemic intelligence, basically tracking these outbreaks from where we are, trying to find as much information about on the epidemiology side, case numbers, working like supporting regional offices, surveillance and lab and stuff. And my main project that I'm working on is doing a kind of literature review of all the literature on yellow fever in all the endemic countries, and developing country profiles for each country on their vaccination coverage, on their past outbreaks, epi situation. And the strategy I'm working in is a 10-year strategy to try and eliminate yellow fever epidemics. And so they will be using each of these country profiles to prioritize the campaigns, the vaccination campaigns, and over the next 10 years. And they want to have a kind of overview of all the country, each country specifically. So I've been working on that. There's 30-something profiles that I've done, basically taken my whole 4 month. And that kind of linked to how long my internship was. So when I applied to my advisor, I was looking at maybe doing a 3-month internship, which is actually, it's probably better if you do 4 at least. She wanted me to come for longer, but I couldn't justify it. It was too expensive. But I thought, yeah, okay, 1 month more than 3 months. It's not so bad. And that was linked to that work, but also working on a lot of other things as well. So as I mentioned, doing some mapping, that's also linked to the outbreaks as well. So mapping where the cases are and stuff like that.
Sorry, I think that some other people might have their microphones on because there's lots of background noise.
Yeah, I just muted them. Sorry.
Sorry.
Yeah, and also we've held quite a lot of meetings. It's the start of this strategy. So, for example, today we're in an all-day retreat working on developing some work plans and doing sort of that. And as an intern, you're kind of working on a lot of the writing the minutes and working on the presentations and that sort of stuff. But it's really great because you get exposed to these really high-level and really interesting meetings as well.
Cool. So for me, I'm working as Dina in the Global Coordination Mechanism on Non-Communicable Diseases. So non-communicable diseases, like cancer, heart disease, diabetes, respiratory conditions, mainly related to lifestyle, but also environmental reasons as well. So our particular department does kind of multi-sectoral and multi-stakeholder engagement. So it's kind of bringing people together to try and work on solutions, like policy work. It's quite broad and it can kind of fit to different contexts. So my particular part of it is, so what my supervisor does is, it's a fast track initiative in 12 selected countries where they're working with governments where there's already a fairly good healthcare system set up, but they might have quite, quite a bad profile on NCDs basically, and trying to find solutions to help them improve. And so I've done a mixture of work. So when I first started, like I said, I was first started just before Christmas and there wasn't a lot happening. So they got me put on a project, which is still actually ongoing. I was working on it today, which is quite boring. It was just making an NCD profile for all the different 12 countries. So just kind of collating all the different documents about NCDs in that country, kind of.
That's basically what I'm doing, but I'm not a fever. That's so weird. The same profile. So I think mine's more for kind of looking at, for when someone from our department goes on a mission to one of these countries, so they've got all the information about what's the record on NCDs like in Oman, for like we're working on Oman recently, on Oman, what recommendations has WHO made to them, how have they followed up on these recommendations, what's their progress, and things like just putting like biographies for the Minister of Health, contact details, and previous travel reports and people have gone. So that kind of stuff, which is quite good in terms of giving me a bit of an understanding of how WHO actually works in these countries and how,
the actual process goes on with making a strategy with the governments to say, what are we going to try and tackle, how are we going to do it, etc., and then the follow-up. So I've been doing that. And then more recently, I've been working on, my department's got lots of different projects they're working on. So I've been kind of putting together funding proposals that we can give to sponsors. So that's been quite fun, actually, because you're working with lots of different people in the department, talking to them about their project, and helping them write a catchy blurb about it that a donor might want to invest in. And then the last couple of weeks or so, my department's had so the heads of our department have been going on missions, one to Copenhagen, and then one that's ongoing at the moment to Oman. And so I helped with preparing the documents for that, and preparing the briefing reports for the Assistant Director General who's going. So I mean, to be honest, a lot of it is kind of I do my version, and then my supervisor looks at it and changes lots of stuff. So but that was really good, because it was very interesting to see how a mission works, and feel like you've got some input into that. Although that was good, but it can get quite high pressured, because everyone's under lots of stress trying to get all the documents ready by the deadline. So, and I think as an intern, you don't have that much control of your time in a way, because my supervisor, it's good that my supervisor is quite hands-on, and we interact a lot. Her office is just next to mine, and we talk all. But I don't really get left to do my own project. It's very much, she'll send me an email, I do this, I do something else. So, you quite keeps you on your toes. But no, that's my day-to-day work. And I think,
All right.
Yeah.
Okay. So what's it like working at WHO headquarters? WHO headquarters see themselves, and that's also how the task is projected onto them, as the top of the pyramid when it comes to the global health organizations. There's different NGOs, civil society, private sector, and all these people engaging in global health, and WHO is at the top of these, and especially WHO headquarters. So what we do is actually coordinate all these people spread around the world engaging in global health and in different departments. She's working on emergencies, we're more working on non-communicable diseases, and the global coordination mechanism is, like she said, more coordinating the different stakeholders and the different people engaging on NCDs throughout the whole world, and trying to make sure that they are connected together, also to be more efficient in their work and not to double efforts. But also what we do is, and that is, I think, a pro and a con to working at the WHO headquarters, is that we're, like Rania already said, we're far away from the actual happening, and from where, we just pass the recommendations, but it's up to the country levels and also the member states to actually implement them. So the difference to working in the country level is that at the country, you actually see more of the outcome and the effect that what the headquarters pass on is implemented on the country level or not. And you can follow up on that more precisely. But then also you only have a focus of that country level or that regional level. Whilst from the headquarters, you can have, like a general overview, which might lose some knowledge, but also helps you to have, the general aspect of working for, this globally ruled or governed entity. My day-to-day work is basically similar to Ali's, which is more like coordinating, making sure that our department is visible towards the outside world, and our work is visible. We have different campaigns that we do for non-communicable diseases that I'm currently working on with my supervisor, but also a day-to-day work depends on the department, because I would say our department is not as practical. So I think your work is more practical. So you do more, country research and actually, have skills that you can apply. Whilst for us, it's more, because we're a coordinating mechanism, it's more bringing people together and working through meetings, through working groups and communities of practice, and taking out what people from the outside world recommend to us and draft that into, resolutions or recommendations that we can then disseminate for countries and member states to implement in their countries. So that's what our department is working on, and that we as interns are helping to achieve.
Yes.
What have you gained during your time at WHO? I think it varies. Like for me, it's more like I thought I would come in and do practical work, and I end up doing less, results oriented stuff than actually, learning how to network with people, learning how the whole, political aspect of this organization works. I think that is also an important aspect. It's not necessarily, you don't really do research and do all the stuff that other more practical departments might be doing, but you still gain a lot if you keep your eyes open, if you, if you stay open for learning different kinds of aspects and not limit yourself. I'm here to want to learn this. So I think, as a general recommendation for being here as an intern is to stay open for all kinds of, input you might get, and that might enhance you.
I think that links, I was going to say two more short things. It links quite nicely. So part of my time here at during my internship, I was part of the group called the Intern Board. So is Ali. And one of my role was organizing these events called Experts for Interns, which is super cool. I'm obviously biased, but I think they're a really cool opportunity. They basically are presentations by different speakers from all the departments across WHO. So there's a tendency to stick to your own department and be working. So for example, me, I'm working on yellow fever all day, every day, and that's your focus, and but there's so much more to global health and so much more to WHO. So it's really cool. You get to have these kind of weekly or fortnightly seminars or presentations that for me, it's a way to network with different people across the organization, but also to hear about what's going on. And that's been a really great way to meet other interns actually. And I've learned so much from other interns, as well as, organizing these. So meeting lots of different people across WHO. And in terms of the things I've learned during my time here, I would say I haven't as was said already, I haven't learned necessarily any hard skills. So I haven't learned how to do spatial epidemiology. I haven't learned how to use a stats program. I haven't learned to use XYZ. The training, it's not really that sort of training. It's more learning about the political games and how people work together, and the way that different organizations work with each other, and how hierarchical WHO is, and how bureaucratic it is, and how slow things take, and how the timelines are related to that, and learning lots of things that you can't really put your finger on, but you've learned a lot just from how it works, rather than actually learning anything to say, okay, now I know how to manage a big data set or XYZ. It's more, I understand why people talk the way they do to different people, because it's all just unspoken things that you can only see when you're here.
Yeah, it's similar to the other two. I'd say, like, if you are doing an internship here, it's important to try and, have an idea of what you want to get out of it, but also be open to, getting other things out of it that you never thought you would. And just try and talk to as many people as possible, like really get to know your team. And so a lot of what I've learned is just by kind of chatting with people in my team, even kind of not, strictly officially about my project, but just kind of them talking about the organization, or them talking about other people they've worked with. I learned a lot through that. Also making time to go to these talks and events, actually, because I found out actually a lot of them are really interesting, and there's usually a couple of talks on every week, and they're actually really good. But I think it's good to kind of make sure you prioritize your own learning as well, because there's a couple of these talks I wanted to go to that I've said that I plan to go to, and then my supervisor's been like, oh, I need you to do this and print that. But I think it's important to just try and prioritize. I know it's difficult when you've got someone expecting you to do jobs, but try and prioritize the things that you feel you're going to gain from as well, just to make sure you really make the most of it. Yeah, that's
okay.
That was a long one.
So the next one is about Geneva outside the headquarters. What do you think of it? Do you like it? Is it lively? What do you do on your free time on the weekends? Is it that expensive, or?
Who wants to go? I feel like I've spoken a lot, so you guys.
I can go. Geneva outside. So I've been here for a conference before I came here for my internship, so I knew the touristy aspects of Geneva. The thing is, you actually figure out, you get your way around Geneva in a weekend. You've pretty much seen all of it. But then there's also, it's more to the activities that the city has to offer. And because Geneva knows they're quite a boring city, they offer many, many activities for every types of person. Like if you like to party, there's always different types of parties. There's different types of theaters, art, exhibitions, all kinds of stuff for every, you know, cultural interest that people might have. So that's a good thing. Also, there's a lot of, you know, a lot of the social work that is offered through the Intern Association, and WHO's intern board is doing much for the shout out to all internet people. It's doing a lot for social activities because they know obviously Geneva is expensive, and you know you get the most out of it in, you know, doing stuff together. So yeah, and free time and weekends, yeah, do stuff with your fellow interns. You're all on the same boat. Everyone came here not knowing anyone else, so try to connect to each other, have you know, different activities and invite a lot of people to them. So the bigger the group, the merrier. So yeah, I think that's it. And outside the headquarters, there's exactly like everything really depends on how much you want to give out and spend for your activities. So it depends on how fancy you are, I guess.
Yeah, so yeah, well, it's like Dina said, Geneva can be a bit of a boring city in a way because it's quite quiet. All the supermarkets close at 7, which makes it really hard to do my grocery shopping. I always have struggles with that. And then at the weekends, pretty much everything is shut down on a Sunday. But I think the good thing about Geneva, one of the good things is it's so close to the countryside. So in the summer, there's lots of hiking you can do. Like you can get the bus, like with your monthly bus pass, or just for like a couple of francs, you can get out into the mountains and go hiking. Same in the winter. So I've been skiing a couple of times, which, you know, although it's expensive, it's a lot cheaper than if you were going from the UK or something. I've also been up hiking in the mountains, which was really, really affordable and good fun. So I think those are good things to do. And then I feel like my time is actually really, really busy here in Geneva. So in the evenings, there's a gym at the WHO. So I've been going to spinning classes there and yoga classes. So and the gym's only 5 francs, €5, whatever, for the whole time you're an intern here, which is really good. So there's that, so you can keep active. And then yeah, I'm on, like Ranya said, I'm on the intern board, and my job there is the social coordinator. So within WHO itself, we do try and organise quite a lot of social events for interns. So tonight, some people are at a pub quiz that we didn't organise it, the pub quiz existed. We've organised a team to go along to there. And then we organise like weekly ice skating trips. There's a place you can hire skates for like 2 francs, it's cheap. And then we organise a drinks event on a Friday, so there are events which we organise to, you know, for the interns to meet each other. So yeah, I think that your time can be really well filled and not expensively. There are definitely cheap things to do in the city.
So I don't know why. So it's this general perception that Geneva's boring, and they both use the word boring, but I really, out of all the stuff they said, how can you say that Geneva's boring? I'm gonna say, put it out there that it makes me a little bit upset when people say it's boring, because as you've heard, it's really not. There's loads and loads of stuff going on, and if there's the nerdy side to you, there's loads of free lectures and events going on. So for example, there's a university called the Graduate Institute, and they do really, really interesting lectures in the evenings, and I've gone to quite a few, and they're really, really interesting and cross loads of different subjects. Then there's loads of other kind of sporting events. So we've been to ice hockey, and we've been to, there's rugby, there's loads of different events. And in the summertime, there's a lake and the river, so you can go swimming. So I guess that's another thing, if you can come in the summer, because it's supposed to be much, much nicer. There's free music events, you can go swimming in the lake every evening if you want. It's really, really beautiful. And then on every Friday night, there's the social coordinators for the intern board organise a cheese and wine night up on the 8th floor of the building here, which has a really beautiful view, and that's always highlights my week.
Thank you.
And yeah, so there's so much going on, and it's really interesting. It is quite expensive to go out, but you can just choose the things you want to do. There's some really cool markets that you can just wander around. You don't have to buy anything. You can just look at stuff, flea markets and farmers markets and everything. And yeah, I think it's a cool place.
And it's a nice small city that you can get around easily. You can just go for walks and wander around. It's nice. Yeah.
Next.
Okay, so next one. Can you tell us about your professional plans after the internship? And do you believe this internship will help you find a job afterwards?
Yeah, you guys can start on that one.
You were good.
That's the dreaded question when you're in intern. Everyone's like, so what do you do afterwards? You're like, I don't know.
Yeah.
But I guess you guys have a bit.
Shall I start? Okay. So as I said, I'm just qualified as a doctor back in the UK. So I've applied for medical jobs and because they pretty much guarantee you a job in the UK, it's great. So I'll be starting work as a doctor in like July, August time. So I think that from talking to consultants here and stuff, and there are quite a few people with a medical background, but what they tend to have done if they want to, work somewhere like the WHO in the future is they've what's the word? So they've spent time working as a doctor, getting specialized, having your area of expertise within medicine, that you then have that skill that you can actually use within the global context. So, global public health context. So I think that's what I plan to do, because I thought maybe, I won't go to be a doctor, or I'll just do it for like 2 years and then move into doing public health. But coming here actually has been quite useful in terms of, I think, I will have much more useful skills, be more employable if I've got an area of expertise, be it like mental health, be it geriatric, anything. It's something useful. So I think I'll do that for a while, and then I'm probably planning on taking a master's degree if I can get them together in something like global health or development studies, or I'm keeping an open mind. And then, I don't know, I thought maybe going to work somewhere like MSF for a while. I don't think it's something I'd like to do long term, because I'd like some stability of, having the place I live in. But doing something like that would be interesting for a while. And then I'd be quite keen to get involved in maybe like working as like health advisor in the UK government, or maybe coming back to somewhere like WHO. Although I don't think I'd want to live and work here permanently, because I don't know.
It's too big for you from your small island.
Yeah. I'm from a really small island, so I can't cope with big cities like that.
I felt like it was everyone's just got such serious faces. And now I'm like,
wake up, you guys.
Yeah, there you go.
So I don't think I want to work in Geneva long term, but I do think that this will be just not just like having WHO on my CV, but having the insights that I've gained from learning how an organisation like this works will be really useful if I want to work in the NHS, I want to work in UK government, because all these people interact with WHO, and it's good to have that knowledge. So I do think it's valuable even if you don't want to work for WHO in the future, because okay, someone else.
So for me, I want to become an when I grow up, I want to be an epidemiologist. To work in epidemiology is kind of from what I've been learning, it's kind of essential to have a PhD, or at least some sort of extensive epidemiological training. So whether that be field epidemiology training or a PhD in epidemiology as your kind of startup. So I'm looking at PhDs after my internship, not necessarily straight away, but maybe soon, maybe not. Kind of depends on what projects there are, because I'm interested in doing it soon, but I'm not going to rush into it, basically. And yeah, I want to stay in infectious diseases and kind of with the epidemiology side. I think I want to, as I mentioned before, kind of work a lot more closer to the action, I guess. So just working at the country level, and whether that be in the UK as my kind of basic training, but definitely abroad as well. So looking at PhDs that kind of have a lot of field work as a component of it. And then in the long term, I have no clue. I don't know where I'm going to end up, but that's my short term vision. I want to stay in epidemiology. That's what I'm really interested in at the moment, but who knows what's going to happen after that, what's going to interest me after that. I could see myself coming back to WHO, but not time soon. Not because, I just want to be closer to, I want to be at the country level or regional level. And I personally don't see WHO the kind of place where it's a good professional development place. It's a place you come when you're an expert in what you do, and you can really make some really cool decisions, and you can do really big things, but you have to really know your stuff, and it's not the place where you gain that experience, and it's quite a hard place to work your way up. But I think for me, doing an internship is a really, really great experience to learn how it all works, so that I know what I'm getting myself in for if I do come back.
That's true. Like lots of lots of people in my department, from just talking to them or looking at their CVs online, which I've done, they've most of them have done a similar thing. They haven't worked their way up through WHO from the junior level. They've been, like, my supervisor was a director of many hospitals across Paris, and then she worked as a health advisor for the French government for a while, and then she worked for the French mission. So she gained all her experience in those fields and then moved into WHO. And I think
Is she a doctor?
No, she's not. She's got 3 master's degrees though.
That's a bit unnecessary.
Unnecessary. But yeah, so I think quite a lot of people have done similar things, get experience. So you've really got some skills to bring to the WHO rather than just working your way up.
True.
So I don't think it's good to go to the WHO with it being your dream that I will get a permanent job here, or else my internship's wasted.
And I mean, if you do want to work in the UN system, it can happen and you can work your way up, but it's just quite difficult. Yeah. So just bear that in mind.
For me, it's quite the same actually. I think a good thing was that I did it right after I graduated from med school, because that helped me to just, narrow down the options that I have and be more certain on what I want to do. So I think for me, it's also I'm better advised with taking up my career path in residency and becoming specialized in my field, and trying to see what options there are for doctors to work in the public health. Apparently doctors and public health are close related anyway, so you can easily find work in the global health field without having to necessarily go into the WHO and all that stuff. But as Ranya also said, WHO is not a place where you would want to start off as not being a senior and trying to work yourself out, because that's not how it works in WHO. But certainly the internship at WHO will help you find a job. Of course, it's good that you can say you had this experience at an early stage of your career, and you had this insight into especially if you go into NGOs and so on, because they work closely to WHO. So having someone who's already been familiar with the system and their work is a good thing. And of course, no matter how bad or what bad light it shades on being an intern and the aims, it still does look good on your CV, no matter what.
I think that's Good. I know, just something I can't remember who said to me, which I started trying to do, is to try and make the most out of because it can feel like you just work on one little job and then another little job. I've been trying to keep a log of the things I've been doing and what I've gained from each of the different projects I've been working on, what skills I've learned, reflections on it, because trying to look back at your whole internship, it might be just a bit of a blur, oh, that's cool, I learned lots of stuff, but it's quite good to kind of keep a record, pick out those things, so that for job interviews in the future, you can really pinpoint, this is what I gained from it, this is what I gained from it, and use those experiences. So,
Okay. Thank you so much. So we go to the last one. So you have talk about what you like the most, but what you like the least about working at WHO. And if you have any additional comments before we go to the open. But I think again is gonna kick us out.
It's gonna kick us out. Okay.
7 more minutes.
Okay.
Okay. We'll keep it short then. We'll keep it within 7 minutes. Yeah.
Just that. Go for it.
Least. Do you want to know least?
That's way longer than most.
Okay. Least. being at the bottom of the pack, being at the bottom of the hierarchy. In WHO, you really, really feel the hierarchy here. It depends on your supervisor and how much they back you as a young professional, as their intern, but more often than not, you're the only one like advocating for yourself. And so you can often feel like kind of the bottom of the heap. You know things, you're not stupid, but in this big, huge place, you are the bottom of the pack, and that kind of is quite frustrating sometimes. For me, it's kind of repetitive, but being away from what I'm kind of working on, making these comments and making these decisions so far away from what we know is the best for country level, because maybe it is the best decision and that's what we've got our information, but you are really far away, and so I find that quite frustrating sometimes, and that's sort of why I want to get a lot more experience doing stuff at country level. And being in Geneva, it's expensive, and I think that's something that really nags in the back of your mind, being an intern here. And I think those are things off the top of my head. But.
Yeah, I just mentioned the least though. You didn't mention anything positive.
Oh, I thought that was all we were doing.
Yeah.
I think coming out from a master's and doing research in global health, I really, really had an amazing time learning about the kind of high level decisions and getting exposure to some really important meetings and important things. Meeting all the people who work in WHO who have done like incredible things in their past. And learning about all the different like routes that people can take, and kind of getting inspired by different things that people have done, and like, oh, I can see myself doing that. Sometimes I wasn't really sure where I could see myself going next, but I feel like I've learned from a lot of different people, like, oh, maybe I can do this or this, and weighing up where like you can find people who you can kind of have either official or unofficial mentors who kind of inspire you and say, okay, I want to be like this person, this is the route they took, maybe I can take something on this line. People who can see and understand how frustrating the WHO system is, and I find it quite frustrating at times, and so being able to understand the system and speaking to people and meeting the people who work at WHO has been one of the best parts of my internship. And also meeting other interns and seeing what everyone's up to, because I think people are going to do really cool things, and it would be really cool to know where everyone ends up in the future. I think maybe we'll come on to this, I don't know, but I think what Ali said before is really important, to keep a log of the stuff that you've been doing. But also I have one project that I'm doing this whole time. I mean, I'm getting pulled onto different projects and other meetings, and that's really cool, but I think I'd recommend doing one big project, and then you're responsible for that one project, and you can kind of have ownership over it. When you leave WHO, you can say, I've done this one project, and hopefully people will, see your work as a whole in the one big project. And I think that's when I come out of it, I'm going to be proud of like this one thing that I've done, or a few multiple sections of what I've done. And I think with that, you can kind of run with it as well, and you can reach out and speak to other people in different departments. And that's been also cool, not just being in. It's also great to build up those relationships, but also just see what everyone else does across the organization.
So I'd say, what was I going to say?
Yeah,
I can't remember.
Yeah,
sorry.
We've only got 3 minutes left.
So in terms of, I think I feel very lucky that I had a good supervisor who's very hands-on with me, who's always getting me to come into meetings and getting me quite involved in her projects. I think partly that's because she's got a very busy job and she needs an assistant basically. But I've spoken to other interns who feel very cut off from their supervisor. They barely see them. They're just kind of given some work and then they sit in a room and do the work. So, I mean, that's partly luck of the draw, to be honest, but I do think you can have a bit of agency over that yourself, and just, if you feel like your supervisor is not really engaging with you, either push them to kind of be a bit more proactive with you, or like Ranya said, like you can seek out other people who may be more inspiring to you, who maybe have more time to engage with you, give you feedback, give you advice, etc. I think one of the good things is about like working with people here, I think really makes it feel a bit more attainable working in this kind of field. Like you can really see yourself and see it's not just this kind of superficial, like this kind of distant body of oh yeah, that is the WHO. You really feel like, okay, these are people just like me, they managed to get there, and yeah, so you feel, yeah, like you could do that kind of thing. So I like that. Things I like least, yeah, like being the bottom of the pile, I suppose. Sometimes I feel a bit out of my depth. Like you're working with people who really understand these projects and worked in them for a long time, and sometimes I feel like I'm not really doing the best job that I could do because I just don't have that experience. I just feel a bit out of my depth sometimes.
Can I really quickly, are we going to do another link because we're running out?
It depends, it's up to you. What would you like to do?
I mean, will people have questions? I mean, I'm happy to get another link, but I'm just worried that we're going to...
Okay, when we have another link, just to close up and have a few questions.
Yeah,
okay, thank you so much. Okay, there you go again.
No, right. Yeah. Should do another link then.
Entirety of their internship.
Mm-hmm. I think we have a Geneva Internet Association here that is actually like, you know, speaking or representing all interns associations throughout Geneva, but they don't necessarily offer scholarships or funds, but they work with organizations that do. But then I think it's also depends on what country you're from and where you're doing your internship. In Geneva, the organization itself doesn't offer you any funding, so you should work that out before coming here. And especially, you know, like already mentioned, talk to your governments, find, you know, internships, scholarships that provide funding for people aspiring to work in international organizations. I know in Germany there's a lot of them, and some other countries in Europe do offer them. But also this has been a really big issue here for people that don't have the resources, especially from, you know, less or middle income countries, to come here and have an internship here, which is something that we have an initiative here in Geneva that we work on to you know, get fair standards for interns to work here and to make this more accessible for other people from other parts of the world. But then, yeah, there's no real funding from Geneva or from places in Geneva to fund your stay here.
I think that, I mean, I thought maybe it would be possible to get a part-time job or something while I was here. To be honest, I don't really think that's very feasible because first of all, I don't know, Switzerland's quite strict about it's like working working restrictions. So I don't quite know how that would fit into that. But also just time-wise, I don't think I could commit to something because I feel like, you know, the hours you work, I just wouldn't be able to go and do an evening job after that. The most I would be able to do would be like maybe something on a Sunday, but and also because you're not here for a very long time, again, I think it's hard to find a part-time job. So yeah, for me, I just like worked very long hours before I came here to save up enough money. So, but I know that that's not feasible for everyone, because of when you do it or what your living circumstances are. So yeah, no, I mean, I think financing is a really big stumbling block, and it's really unfortunate that is the case. And I know lots of people are trying to work on making things better, but as it stands right now, it's it's quite difficult.
Okay. Yeah, we have another question from Pitarillo. So you're unmuted now. Please go ahead.
Hello, hi.
Hi.
My question was regarding time management, because I've heard that working as an intern, some people say like you have to do extra, so like come in early, leave late. So I wanted to know how true that is, and like how did it come as, did you know that before going there, or did it come as a shock to you? Like, how did you deal with it?
I think it's really dependent on your supervisor.
Okay.
It's really difficult to say without like talking about your supervisor, because they obviously know who you are. Yeah, if your supervisor, like for example, in health emergencies, it's very fast paced. Things are changing every day, and you need staff really fast. And yeah, I have to work quite a lot over, they say, oh, none of your hours are 9 to 5. I never work 9 to 5. If I left at 6, no one would say, oh my God, you're leaving so early. But it's difficult because you need to get the balance on, yeah, you want to perform well. You're not coming here and doing a half of it. I think, yeah, it's up to your own personal preference on how much you want to do it. I mean, it's definitely a learning curve on being able to say no. Like at the beginning of my internship, I'd say, yeah, I'll do everything you asked. Like everything you asked me to. Actually, no, I'm not going to. I'm going home at 6:37. I'm an unpaid intern. I mean, and they have to, you know, you've got to learn to know when to say no. I don't have the capacity to do that. I'm not staying here till 10 or 11 doing this. I work sometimes, do lunch, and yeah, you just got to do it. That's just how it is in the workplace. But I'm not going to work through lunch every day. It's just not. I personally don't think it's a productive way to work. I tell my supervisor, I'm like, you shouldn't work through lunch every day. It's not productive. You're not productive in the afternoon. I know for myself, my concentration dips. So working a longer amount of time doesn't necessarily mean you're going to produce better. So it's just, yeah, it's a very good point. I think it's definitely something that I've learned here, just getting the balance between, you know, saying no, saying yes, and yeah, managing your time, and you learn where you produce the best work, basically.
Also, no one's going to tell you, go home, you've overworked yourself, and so on. No one's really here to play the parent role, you know. So you should see yourself when you're overworking yourself and not getting the best out of your time, or missing out on so many social events because you have to stay in late. Just, you know, find the balance for yourself.
Yeah. And if your supervisor goes home and you're still there an hour later, go home. Yeah, it's not fair. It's not fair. I mean, stay a little bit. You want to finish what you're doing, but an hour, 2 hours? No, that's not.
So for my department, I think because we said we're both working on communicable diseases, and a lot of our work is less, fast paced than what Ranya's doing. So it's often not as urgent. You can put stuff off to the next day. So I think I generally keep fairly regular hours. So when I started, they said my official working hours were 9 to 6. I like working more early in the morning. So sometimes I'll often come in for like 8:30. I mean, sometimes I'll come in earlier than that, but usually not. And then I'm usually done by 6, sometimes earlier if I've got a commitment to go to. Occasionally I've had to work later, like the other day I was working till nearly 9, but that was, and I didn't have a lunch break, but that was really a one-off. Like I hardly ever do anything like that. And that was because we had a lot of work for a country visit coming up. So that's the thing, that I think in any department it will go in peaks and flows, peaks and troughs, depending on what's actually the projects. But I think, in general, I've managed to keep fairly good working hours, and my supervisor's been quite understanding if I say to her, like, no, my yoga class starts in half an hour and I want to go to that, that's important to me. She's usually been okay with that. She's actually been very supportive, and she'll often be the one apologizing when she's asking me to stay a bit later, or so she's actually quite good at looking out for my welfare, but I don't know about others. But I think there is an element of you've got to kind of look out for yourself sometime, but I wouldn't say it's as horrible as I've heard it could be in other places. So.
Thank you.
It would be good to ask a supervisor beforehand.
Yeah,
about
that's
hours,
true.
Work this out before you arrive, so that you have a picture of it.
Yeah, don't just ask them like what are the kind of official working hours, but say what would your previous interns done on a daily basis. I think it's good to get an idea.
Yeah. Thank you.
Sorry.
All right, I think that was all the questions the remaining audience had. So just thank you so much for joining us today. And I think that's it. I will gather the links.
We got quite a lot out of it, of like reflecting back on our internships.
Okay. Yeah,
so that's good.
Yeah. Go ahead.
Cool. Thanks.
Great. Thank you.
Thanks.
Bye. Good luck. Oh, did you want email addresses if you wanted to?
Yes, you can send them to me, and then I will send them to you. And if you have any links also, you can send them to me, and I will forward them to them.
Right. Great. Bye-bye.
Bye. Bye-bye. Thank you so much.
Thank you.
Sure, bye.
How do I quit?